morning and welcome from the Senior Law Day Collaborative. My name is Sarah Steckler and I'm also one of the 3 co-chairs of the collaborative. I share this role with Elena Falcone.
Good morning, everybody.
Westchester County Library System and Melinda Bellis from Legal Services of the Hudson Valley, and I'm Sarah Steckler from Keene and Bean. You've joined us today to learn about Medicaid Home Care from David Sweet from the Department of Social Services, who's here to give us a tutorial on Medicaid home care A to Z and everything that we should expect from his office. So just before we begin, a little bit more information about the collaborative. The Senior Law Day Collaborative is composed of more than 150 professionals who are all eager to bring authoritative information on legal, financial, and healthcare topics to Westchester County's older adults. And we hope that some of the professionals joining us this morning might be interested in joining the collaborative as well. After our presentation today, we'll have our materials available on our website, which is www.seniorlawday.info. And that's also an authoritative site of information in which we've been posting all of our programs and where you can ask us a question if it's not addressed here today, or even if it's on another topic and one of our many professionals will get back to you to answer that question. So without further introduction, I'm going to turn the program over to David Sweet, and he's going to share with us his information on home care Medicaid this morning. So thank you so much, David, for joining us.
Thank you, Sarah, for the invitation, and also Bruce Siegel, the producer, and the Westchester Library System. Can you hear me okay?
We can hear you, David. Thank you.
Okay, good. Medicaid and home care services is a complicated topic, so I don't expect that people are going to understand everything that I'm going to talk about this morning. But I just wanted to give you an overview. And also, we put together some documents that we're actually still working on getting them all to be able to be viewed publicly that can help you even when this session is over. Okay. And the first slide is just the heading, Medicaid Home Care Services 101. I was going to call it for dummies, but 101. And that's me, David Sweet. I'm the manager. I've been with Westchester County Social Services for over 31 years. And that's how you can reach me. Telephone, fax, email is very helpful. I probably get about 150 emails a day. Luckily, they're not all just to me. We have staff that also help to handle them. Okay. Primarily, what I'm going to read from now, hopefully it's public, I believe it is. It's just some notes that I took that I can use as a guide to this presentation, and you also have it available so that you can also go back and take a look. We provide personal care and CDPAP, or Consumer-Directed Personal Assistance Services. We also provide private duty nursing in some cases and short-term services until a person is on a managed long-term care plan. We provide the personal care and CDPAP for Medicaid waiver cases, including from the Office for People with Developmental Disabilities, or OPWDD, home and community-based services waivers, which now encompasses all of the children's waivers combined. Also the Nursing Home Transition and Diversion Waiver, NHTD, and their sister agency, the Traumatic Brain Injury Waiver, TBI. Medicaid waiver cases are exempt from managed long-term care, though for the children, they can choose to have traditional managed care. We also provide the personal care and CDPAP for hospice cases, which are also exempt from managed long-term care, and that's end-of-life care. That's actually the longest Medicare home care program. Hospice cases can have a 6-month authorization and even be extended if the person outlives that authorization, where other short-term visiting nurse cases are generally just a few weeks when someone comes out of a nursing home or a rehab. The county also provides something called Level 1 service for people who need 8 hours a week or less for cleaning, laundry, and shopping assistance. We often work with visiting nurse services where we'll provide the Medicaid portion of the service while the visiting nurse, or we call that a CHHA, Certified Home Health Agency, pays for the Medicare portion and helps to manage the medical needs. Sarah just told me this morning, I was going to say that as of October 1st, Medicaid is going to be increasing the look-back period at people's resources, such as bank statements for home care, which is currently current resources. We generally ask for 3 months because Medicaid for home care can be retroactive up to 3 months. As of yesterday, that was going to increase to 30 months, effective October 1st, but Ms. Steckler just informed me that that was delayed until January 1st of 2021. So if you are thinking about applying for home care, and if you might have done some transfers of money a year or 2 ago, you might want to get that application in this year so that we'll still only be looking at current resources. Personal care is when you use one of our traditional personal care agencies that are on our list. And those aides are certified aides with the agency. CDPAP is when the family hires and trains their own aides. They don't need to be certified, but they do need to be registered with one of our CDPAP agencies. Later in the report, I'll say which slide is the vendor list, but they all are labeled. An important thing to remember is when somebody submits a Medicaid application for home care, they sign a document stating that as of that point forward, they need to use one of our Medicaid contract agencies. That way, we can help to pay for the service if they're qualified, and in some cases, we can even help to pay retroactively. It's very complicated if they're not using a Medicaid agency, and they might not be able to be reimbursed at all. CDPAP aides can provide additional tasks not allowed by the traditional personal care aides, and this was through a program through New York State Department of Health and Education Department, and it required a certain waiver from the nurses profession to allow these aides to be able to do certain nursing functions that they are trained by the family, such as providing insulin injections or eye drops, or they can even be trained to do things like feeding tubes or trachs and suctioning. Our private duty nursing program, for example, is a small program and there's a nursing shortage. So often if we don't have enough LPNs, licensed practical nurses, or RNs, registered nurses, we may go to the CDPAP program to help to supplement some of those hours of service. Okay, now I'm going to number 2 on the brief write-up that I have. Okay, slide 2 is our 1050 form, which is the physician's order approved by New York State. How do we get started? I receive a call or an email and determine if the person has Medicaid, whether they need to apply for Medicaid, or what type of coverage do they have. Some people have the coverage, so they can proceed, and they can call Maximus, New York Medicaid Choice. Their information is on slide 4, and their number is 1-855-222-8350. I have that number implanted in my brain. I'll never forget it. And they can request what's called the conflict-free evaluation, which is needed before a managed long-term care, or MLTC, is allowed to assess. There's a lot of information on the Maximus website, which is www.nymedicaidchoice.com, and that's on this document. It's part of the presentation. The conflict-free evaluation right now is being done over the phone because the state has been quite understanding as far as home care, and they're not requiring home visits because of COVID-19. So the conflict-free evaluation is good for 75 days, meaning that from the day of that assessment, you have 75 days to pick a managed long-term plan and be enrolled. Sometimes there might be delays because there are certain cutoff dates. For example, if a managed long-term care plan wants to start August 1st, they must submit their enrollment plan to Medicaid by July 20th. Let's see, if someone has Medicaid coverage but needs short-term services right away, they can send us a current 1050 form, the physician's order, with a recent exam date. The state now accepts tele-exams, again, because of COVID-19. If we're going to put in short-term services, we must use one of our agencies that are on the vendor list, which is slide 3, in order for Medicaid to pay. The managed long-term care cutoff date is the 20th of the month in order to open the 1st of the month. So sometimes if somebody missed the cutoff, we might be able to put in the short-term services. What we do then is, if the family likes the agency that they're using, whether for traditional personal care services or for the CDPAP services, they would then ask the agency which managed long-term plans do they contract with and recommend. Then they would call the MLTC and they would do their own assessment, again right now over the phone, and make arrangements to take over the case from us. We also have 2 agencies on that list that provide the personal emergency response system, which is famously known as the "I've fallen and I can't get up" button. So we are able to provide that through our program, and that is also part of the managed long-term care package. 5th slide is a list of managed long-term care plans. Most people choose traditional managed long-term care, which just manages your Medicaid. There's also a few options on that list for the PACE program, which manages your Medicaid and Medicare. There's, I believe, 2 in Westchester. Most programs you can also, besides getting the personal care or CDPAP, you can also choose to participate in a social day program, or in some cases, a medical day program. The 2 PACE programs, for example, have their own medical day programs, Center Light and Arch Care. That list can also be found on the website over the bottom of that slide, nymedicaidchoice.com. And you just have to click around the website because you can find all regular managed care information. Traditional regular managed care is for people, generally not our folks, because anyone that has Medicaid and Medicare is not going to get a traditional managed care like MVP. That's generally for families with children or for younger disabled people who do not have any third-party health insurance, such as Medicare. But that website is helpful because you have to click around. You can search for managed long-term cares that cover your county.
So I'm going to try to just backtrack a little bit.
Sure.
So this is the links of the MLTC facilities in Hudson, in the Hudson Valley. So if people can, I don't know if someone can chat us and let us know if you can, actually see those. Sarah, can you see them? Let's see.
Yes.
And here I'm going to share the next document, which was the
order.
To share the PowerPoint on our website after the program, which is seniorlawday.info, and the video will also be available in a couple days, so anyone who has to jump off will be able to rewatch it or rewatch the parts that they miss.
Right. Okay.
So that's our personal care vendor list. You'll see the names of the agency on the left. The second column is for agencies that can also do local work for child protective or adult protective services. Actually, that's the third column. The second column is their Medicaid information. The fourth column tells you which agencies also do CDPAP. I think there's one that only does CDPAP as well. But you can always call us or email us and we can help you with this process. Okay, I'm going to start reading at number 3 on the sheet that I had put up there that you can go back to later. That's the Supplement A form, which is link number 5. In some cases, people may only have Medicaid paying for their Medicare premium. That's a type of service that Medicaid offers. We'll often have Medicaid take a look at those cases to see if a full Medicaid application, which is on slide 6 in the form of a link, is needed, or just the Supplement A form, which is slide number 5, which relates to people's resources such as bank accounts. Often, Medicaid will ask for the Supplement A form and 3 months of current bank statements, which are enough to upgrade the coverage from just paying for the Medicare premium to also being able to pay for home care services. And that's when somebody already had filed a Medicaid application, but we just didn't have their bank account information. I often will send people an email with the Medicaid application link as well as the Supplement A form, or Medicaid can mail them an application directly. There's an agency that has a grant that helps people apply for Medicaid for no cost, and that's Westchester Disabled on the Move. And WDOM.org, or they're in Yonkers at 968-4717. They also are listed on one of the slides, which relates to something called pooled trusts, which is slide number 7. let's see. When somebody needs services right away, there is a process where they can send the completed doctor's order form 1050 and something called an immediate need request form, which is part of slide 6. And Medicaid is required to open those applications right away. We also get a copy of those doctor's orders so that we can start opening one of our short-term cases as soon as the Medicaid coverage is in place. They can also send those to Medicaid on new applications, but we ask that they should only be used in cases involving true immediate need and not simply as a means to leapfrog over other pending applications. On the screen, you can see that's the Supplement A form that Medicaid often asks for when they need current bank information in order to upgrade coverage to include home care. Traditionally, Medicaid has 45 days to open a case, and that's why they ask that if it's truly not an immediate need situation, the applicant should not apply for immediate need. But we also can review those situations ourselves as well. The Medicaid application and the Supplement A form and the immediate need form, if that's also being included, they are all mailed to our special Medicaid Home Care Eligibility Unit in Mount Vernon. People ask me, I live in Peekskill, can I send it to Peekskill? And yes, you can, but they're only going to have to turn around and send it down to the Mount Vernon Home Care Unit, which is at 100 East 1st Street on the 6th floor. It's the Department of Social Services in Mount Vernon. And the supervisor is Miss Atkins Nelson. And her information is on the write-up that I did for slide 2, as well as her phone number and email contact information. Number 4 on the slide 2 that I'm using as a guide, there are different types of coverage. Slide 10 has some Medicaid resource and income levels. The New York State Department of Health has a very comprehensive and informative website. You go on there and you click around for what it is you're looking for. Generally, the level for a single person is about $875. I included our staff listing for Medicaid Home Care Services and also the Medicaid department that covers home care and nursing home care, because sometimes it's not easy to reach someone, and this way you have our phone numbers. It also has our fax numbers, and there's also all of our email numbers. You'll see our ID next to the name. For example, my ID is D like David, J like Jack, S as in Sam, and the number 4. Well, that's my email. You just do my ID at westchestergov.com. And that's the same for all of these workers. And this way you can also see which caseworker and supervisor covers which territories.
David, we have a request to show the Medicaid resource. So now I'm on the final link, this one, the New York State Department of Health Medicaid website. You want me to click on that?
Yeah, because that page has the New York State Department of Health website, which takes you right to a lot of information about Medicaid. And then the other link on that page is just a particular random kind of law firm that I found when I was Googling that talks about the Medicaid levels. This is not an endorsement or anything. It's just some good information that talks about the Medicaid income levels and resource levels. For example, there's the 875 for a single individual. For a couple that both need Medicaid, the level is a little higher than that, about 1,100. What happens in most cases is people are going to be above the Medicaid level. And there are strategies for dealing with that. There's different types of Medicaid coverage. For example, if a single person or a couple need Medicaid and they're going to be above the Medicaid level, which is a little over 1,000 for a couple, they can set up something called a pooled trust. And slide number 7 talks about setting up a pooled trust, lists a number of the pooled trusts that we often work with, and even has a link to New York Legal Action Group and their website about pooled trusts, which they continually upgrade. And pooled trust is a very, very helpful tool for helping people to become eligible for Medicaid when their income is over the Medicaid limit, because if they're an elderly or disabled person, they can put their what's called Medicaid spend down or surplus, which is like their monthly deductible, instead of paying it to Medicaid, they're allowed to pay it into their own pooled trust account, and that money becomes exempt from Medicaid. And the key to that is you then work with your trust representative, your pooled trust, and tell them how you want to spend that money, whether it's on your rent or your room and board, or on your taxes, or on your cable, Con Ed bill, groceries. It's a very effective way of dealing with having income that's over the Medicaid level. There's another program specifically for married couples when only one of them needs the Medicaid, and that's called spousal impoverishment. I've also heard spousal enrichment, which is a little nicer. But that allows a higher monthly income level for a couple if only one needs the Medicaid of about $3,000 a month, and it allows resources instead of $20,000 for a couple that both need the Medicaid. It allows about $120,000 if only one of the couple needs the Medicaid. So spousal impoverishment can be a very helpful type of Medicaid too. That can pay for nursing home coverage or manage long-term care, or some of the waiver programs like the NHTD waiver. I just like to give people a little caution, because some people will do something called a spousal refusal, and that will allow them to become Medicaid eligible. But in some cases, and what that is when the quote well spouse says that they're not going to contribute towards the care of the unwell spouse, so that the unwell spouse can be Medicaid eligible. But I just like to warn, because I have got calls from people saying they're trying to sell their house and there's a lien for $150,000 against their house, and why is that? And I'll say, well, did you do a spousal refusal? Yes. Did anybody advise you that the county or state can file a claim against you for support? Maybe yes, maybe they just didn't understand, but that can happen.
David, let me jump in. And we have a number of questions that just came in, and I want to address it before you get too far into the presentation. So we have a question asking, does Westchester have a special location to send or fax a joinder and a verification of deposit for a pooled trust for the disability review?
Yeah, they actually changed part of the process recently. Whichever Medicaid worker is handling the case, you could send the joinder agreement. That's when you are opening a pooled trust. That goes to your Medicaid worker, and those workers can be found on the Medicaid list that I sent. Often they're in the home care unit. And the verifications of deposit would also go to your particular Medicaid worker. If the family is working with me, I will forward that information to the particular Medicaid worker that's handling the case. Now, up until just a few months ago, Medicaid was also collecting the disability determination information because it's almost a formality, but even if you're 100 years of age, in order to qualify for a pooled trust, you had to prove disability. So Medicaid was collecting a year of medical records and 3 different forms, including one from the doctor, and then Medicaid was sending them to Albany, and Albany would review them at the disability unit. Now, Medicaid is only collecting the joinder agreement about the pooled trust and the verifications of deposit. Medicaid approves the trust through the Department of Social Services for our purposes, and then Medicaid sends a referral to the New York State Department of Health Disability Unit, and they directly contact the family with whatever their requirements are to prove disability. Somebody who's on Social Security disability does not need to prove disability.
Okay, and there's a part B to that question where they say in the 5 boroughs, it's very difficult to get Medicaid to put the pooled trust into the system. And then the MLTCs ask for the spend down continuously. How does Westchester get that into the system?
That's a very good question, because you have some cases where the spend down might be $2,000, $3,000. And if the agency providing the service does not have a letter from Medicaid saying that the spend down is exempt because they have a pooled trust, then the agency is going to be trying to collect that spend down money from the family. So as far as New York City, I mean, I have a few contacts down there. I would imagine it might just take some persistence and some follow-up. But for Westchester, what we do is we have a particular home care unit. So once there's home care services in place, we have specific Medicaid workers assigned to those cases. If somebody's on Fidelis Managed Long-Term Care, there's a worker that handles that plan. If they're on Arch Care Managed Long-Term Care, there's a worker that handles that plan. If they're getting the personal care services or CDPAP through my office, then we have certain workers that handle those cases. So then if the agency is looking, or the family says that they're getting billed, what's happening, we can reach out to the Medicaid worker and sometimes to the pooled trust if we need documents, and try to help to get everybody on the same page so that the home care agency has a letter from Medicaid saying that they don't need to collect the spend down, that there's a pooled trust in place, and that the spend down is being paid into the pooled trust each month. So sometimes it just takes some persistence and some follow through to make sure that the right people have the right information and are completing their tasks on our end.
David, there's a lot of questions that came in. Another follow-up to that little piece is, can the disability review document that comes down be automatically computer generated and then mailed to the applicant? Is that possible?
That I'm not sure, but let me write some of these questions that I'm not sure.
We have them and we can provide them to you, David.
Oh, okay, that would be great. This way I can follow up with.
And
Jackie.
another question is, can home care applications be sent in now via email rather than mail?
Do you mean for the actual Medicaid eligibility part of the application?
The whole application.
I mean, I would think so. We do a lot through email. We do have a protected email system. I think if it's like 80 pages, you might want to run it by Ms. Atkins Nelson, who's the supervisor. But
so the preference is to still mail them in unless you have approval to send it in via electronic means.
I mean, let me think. I mean, personally, I don't see a problem with sending it electronically and then saying, do you also need a hard copy? Because from my view, first of all, there's COVID-19, and that means we're not handling those papers right now. And if you're sending it electronically, then you have proof that it was sent, and we have proof also that it was sent and that it was received.
So if it's being emailed, it should be emailed to Ms. Nelson or to you?
If it's a Medicaid application, then Ms. Nelson is the supervisor that handles the Medicaid applications for home care for new applicants.
So then it would be emailed to Ms. Nelson.
Right. And I mean, if you want to have a discussion with her just to get her views, her number is on my write-up, or I could say it to you now. It's 914-813-6612.
Thank you, David. So another couple questions also just to stay on time.
So just so you know, with the doctor's orders, we definitely like to have them either scanned and emailed or faxed to us, because the mail is just very slow, and especially now with COVID.
Okay, so with the disability review, going back a little bit, do we still have to submit 1 year of medical records with the 486T form?
There's a different process now, so you might want to check with Mrs. Nelson about that, because those are not being submitted to Medicaid now, the disability package. Only the joinder agreement and the verifications of deposit. Then Medicaid is doing a referral directly to the state disability unit, and they are reaching out to the client or representative with whatever their requirements are. So I'm not exactly sure what their requirements are right now, especially with COVID.
Okay, so we'll post a list of these questions once we have the answers after the program, so we can follow up. Also, one of our participants asks that when they submit Supplement A and documents for a conversion from the Medicare Savings Program to full coverage for home care services, can you explain the process? Does it go in between departments internally? And who is the best contact for that sort of conversion?
I would say if you're inquiring about home care, it's fine to come through me. And then we have, depending on the level of coverage that's there, there's different people in our Medicaid department that handle those types of conversions. So feel free to use me as a contact.
And Dave, what is the best email for you so people can contact you on those conversion applications?
Sure, it's D like David, J like Jack, S as in Sam, and the number 4 at westchestergov.com.
Thank you. So another question is, do you foresee that applications and subsequent processes may be filed online in the future, like the courts and e-filing?
That sounds good. I know Food Stamps does a lot of work online. I mean, it certainly sounds like a good idea. With the nursing home applications, I mean, they're asking for 5 years of bank statements. That often comes in large boxes. That might be a little more difficult, but it's a great idea. I mean, it seems like everything is going more digital these days, and you know, with the virus, we're doing this kind of a meeting right now through Zoom, and I'm working out of my house now part-time and part-time in the office, so that we stagger. So I think things are definitely going in that direction, but I don't have a specific answer.
Thank you, David. So back to the disability review. Is there a direct contact to New York State to send in the disability review documents? The asker asks, i.e. a phone number and or email to reach an actual person?
Yeah, I think that you would have to either ask Mrs. Nelson or the Medicaid director, who you know, Mrs. Alunkal, Alunkal, and she's at 914-813-6039. But I would start with Mrs. Nelson.
Thank you, David. And we also have a question saying, what is the process to apply for the Medicare Savings Program, and how is the Savings Program represented on the actual Medicaid budget?
Now, that's, I hate to say it, but that's another area where I defer over to Medicaid. You know, I'm very...
So it's a fancy question.
Yeah, I mean, I'm just, you know, my job is to help with the home care and get what is needed to set up the home care services and either put in the short-term services or the managed long-term care, or work with one of the waivers. So I often, and without apology, defer to our Medicaid people for that. I'm not quite as knowledgeable in that area as I could be, and they are.
Okay, and with the disability review, an anonymous attendee asks, can you submit the disability documents to New York State before receiving a request from them? So can you just get a disability review, I guess, and then apply for Medicaid?
I would say, I mean, if Medicaid gives you a contact up there, then you can certainly ask them. But there are people that do have disability reviews that are previously filed, and then later on in life, they need home care. And the reviews are already filed.
Okay, so changing directions. What should new Medicaid home care applicants expect after the new 30-month look-back period is implemented? How will current Medicaid recipients be affected, if at all, especially if they are utilizing a pooled income trust?
Well, if you already have Medicaid, then you shouldn't be affected. It's going to affect people that are newly applying for Medicaid. And it's going to affect when they look to see, has there been money transfers? For home care purposes, now we're only looking at your current resources. If you transferred money 5 months ago, for home care purposes, we're not looking at that. But come the beginning of 2021, they will be looking back 30 months. So people are going to have to look ahead, and they're going to have to plan further ahead to apply for Medicaid for the purpose of home care.
And also regarding the pooled trust, there was some great guidance that Matt Nalfo, who's the chair of the Elder Law and Special Needs section, sent around the listserv this morning regarding pooled trusts. And we'll make that information that was shared on the listserv available after the submitting as well. But they said that transfer penalties would apply to income of a person 65 years that was transferred to a pooled trust. However, it's not considered a transfer if the income contributed was used for the benefit of the applicant. And that additional guidance is forthcoming from the Elder Law and Special Needs section regarding the pooled trust as the lobbying committee hears that from Albany, the legislation committee. So we'll also follow those updates and try to post that information as it becomes available as well.
Yeah, certainly if there's a significant amount of money and people have questions, you would want to consult your elder law or disability attorney.
And the question asker again says, just to confirm, the 30-month look back will not affect people already on Medicaid who are renewing for home care. So they're not going to ask for 30 months of statements on a recert.
No, they can't do that.
Thank you. Okay. And let's just see if there's any more questions quickly. Okay, so David, I think we've gone through the questions and more just popped up. So I'll do these two more and then we'll go through your slides and I'll read the rest of the questions at the end of the program. So we have a question, can a client who's eligible for home care request the PERS only and no home care?
That's a good question. We cannot do that. We can only put in a PERS if somebody's getting home care through us. Now, if maybe they were on, let's say, hospice, but not through us, and they were going to be on for a 6-month period, we might be able to do a case like that. But if they were just on a visiting nurse for 2 or 3 weeks and they're not on our program, we couldn't do that.
Okay, and
But
in
let's say
2020,
if somebody, so you're saying in that case, they do have Medicaid? Because sometimes if somebody has Medicaid and they have a spend down and they want to pay for the PERS, the emergency response system, they can submit those receipts and get credit towards the spend down. That could be an option.
okay, in 2021, there'll be a 30-month look back, meaning there will be a transfer penalty. And if so, can strategies like promissory notes be used for long-term care, chronic care cases?
Sarah, that's more up your avenue. I apologize.
Okay, so the answer is that we don't know if the home care planning will mirror nursing home planning quite yet.
Right, and you can certainly follow up with Mrs. Elunkel, who's the director of Medicaid and who will be overseeing these changes from the eligibility end.
Okay, so I'm going to hold the questions and let you continue the slides, and then I'll ask the rest of the questions at the end.
Okay, I mean, I covered much of what I had intended to cover. Let's see, many cases go straight to Maximus, New York Medicaid Choice, and then to manage long-term care without my unit being involved in the home care. In some complex cases, a person may go to a Medicaid waiver, such as the Nursing Home Transition Diversion Waiver, NHTD. And their phone number's on the write-up that I did as for slide 2. They have an ability to provide extensive services, such as for someone with Alzheimer's that needs supervision in addition to tasks, which may be more than a managed long-term care can handle. So NHTD waiver, I'll just say their number quickly. It's 845-228-7457. They are a small but viable alternative to managed long-term care, particularly when there's complex situations such as Alzheimer's and someone needs supervision above the level that a managed long-term plan is going to want to or be able to provide. Another thing to be aware of, slide 8 lists some Medicaid assisted living programs, mostly the ones where we happen to have people. The two most common in our area are the Westchester Center for Independent and Assisted Living in Yonkers, www.thewcenter.com. That's on my write-up. And also there's the Plaza at Clover Lake in Carmel, New York, which is their sister agency. And they do accept community Medicaid. You don't need the 5-year lookbacks to go to a Medicaid assisted living. And they do provide with a place to live, meals, and light housekeeping. And people are supposed to be fairly independent to live there, but they do have a number of different levels of service. People that need a higher level, they will charge Medicaid a little more. And
David, before we, because we're coming, and Sarah, because we're coming up on 11 o'clock, I did want to just quickly, if it's okay, share the Senior Law Day info site, because I think that will clarify some of the comments that we're getting in the chat. Let me just do that. So hopefully people can see that, and I'm going to point the cursor. First of all, this button right here, 2020 webinars, which is where the recording will be posted. I know a number of you have asked about that, and others that may have had trouble or only logged in on the phone and want to see the screen as well. So that should be there within 24 to 48 hours. And then David had shown some really good information. This is also a really good resource, the Elder Law Q&A, that's updated every year, has some of this overview and information. And we are in the process of putting together the 21st edition, which incorporates some of this new requirements for the Medicaid home care. And then last, I encourage you to click on our sponsors, where we want to thank our sponsors for your continued support this year in this very, very challenging year. So I just wanted to...
Bruce, if you can scroll down a little bit. So under the link where this webinar is Medicaid Home Care Services, we're going to have the materials posted as a link just right under there shortly after the program, so everyone can access them.
Okay, great. So, okay, over to you, Sarah and David, if you want to wrap up or if there are more questions. Or...
Okay, so we have another question. If an applicant wants to change the MLTC, should they contact New York Medicaid Choice, or should they contact the new MLTC directly?
That's a good question. You can't disenroll until the end of the month, but I believe that the plan will want to know by the 20th, because that seems to be the generic cutoff for changes in managed long-term care. I think you'll definitely want to contact the new plan to make sure that you like what they are offering you. And as far as contacting Maximus, the plan will tell you whether they need you to contact Maximus or whether they are able to take care of that themselves.
Okay, and I also just wanted to read that the guidance from the Elder Law listserv this morning was that while the look back would be implemented in January 1st of 2021, penalties will be calculated for transfers after October 1st of 2020. So that October 1st of 2020 is still a really important date for the application. So if you're doing planning and want to get home care services in place without potentially incurring a penalty period, that those applications still should have that target of October 1st of 2020. Okay, we have another question. So one of the questions is, how do we join the Senior Law Day Collaborative? And that's a question I love to hear. So you would just send an email to myself, or it can go to Elena or Melinda. My email is steckler, STECKLER, @kblaw.com, and request to join our collaborative listserv, and you'll join the email group. And if you attend 2 meetings or a meeting and event in a calendar year, you make our collaborative participants list and you have joined the collaborative, and then you're eligible for volunteer opportunities. And we have a terrific group of attorneys and care managers and financial planners who are all volunteering for us. And I do send out regular emails, but not so many. And you sign up for them by sending one of the co-chairs an email that you would like to be added to our list, and we will add you so you get our information. And again, my email is the first letter of my first name, so S, and then my full last name, which is Steckler, STECKLER, @K as in kite, B as in boy, law.com, and the full spelling of my last name is also under my picture in the little box, just in case you need to get that correct. Okay, so let's see if we have any other questions. Okay, so we have one more call for questions. Okay, so one more came in. So David, so who does the assessment for the NHTD program? Is it DSS or is it MLTC?
Not MLTC. As a matter of fact, we have a number of cases where somebody might be on MLTC, but their needs are greater or more complicated than MLTC can manage, so they can disenroll from MLTC. We can start providing their personal care or CDPAP services while they apply for NHTD, because it could take between 2 and 3 months to be fully accepted for NHTD, but we work very closely with them, and very often we pay for the personal care and CDPAP services on those cases.
Okay, and another question came in, which might be a question from Ms. Alunkel, which is your office currently filing claims against a community spouse if they're over the CSRA?
Yeah, that would be for Ms. Alunkel.
Thank you. Okay, so last call for questions. Okay, while we're waiting to see if any more questions come in, we just briefly want to share our sponsor list with the program. And these are a number of individuals and law firms who have all joined on for sponsorship, which make our free programming, the information, and hopefully, once again, our in-person programs and free consultations possible. So I just want to thank our generous 2020 sponsors, and also to highlight that at our August 13th Senior Law Day Collaborative meeting, we're going to be discussing a virtual event that will involve one-on-one consultations with professionals. So we have some very exciting programming coming up this fall. Okay, so the last question that I'm going to take is, David, by chance, do you have a staff list for other departments of social services, such as Nassau, Suffolk, Putnam?
I would have to kind of look. I often will just Google Putnam County. Like Putnam, I just happen to know their main number, 845-808-1500. But yeah, often I'll just Google that. I would have to look and see what I what I have. So feel free to email me if you want me to look into that.
Okay, so we'll follow up with anything that we're able to share regarding contact lists for other departments of social services.
Okay, and yeah, one nice thing, working for the Department of Social Services is that if we have a person that needs home care, but they also need food stamps, we can help to connect them with food stamps, or if they need home energy assistance, like perhaps assistance with an air conditioner, we can try to work with them. Or if we see a really bad hoarding situation, we might be able to get our adult protective services involved. So we have a whole social services department which works closely together. And I would like to say in closing, if I may, just that home care is it's a very important service, and you could even see from the recent COVID outbreak that anybody that we were able to get out of nursing homes and out of rehabs and get them home was in many cases better off. And we're very proud of the work that we do. It's not easy. It takes a family, it takes a community. But it can be very, very rewarding. And thank you all for your interest in this subject. And
David, I have one more quick question that came in for you, if you don't mind. So do you know if the Westchester LDSS 1050 is acceptable to other departments of social services? I know the immediate need form is indeed different for New York City cases, but what other departments take the 1050?
I mean, that's a good question. I mean, it's approved by New York State Department of Health, so they should accept it. But what I would probably advise is if you're working directly with New York City, they use an M11Q. And then there's another form, I think it's a 5320 that a number of counties use. So we would accept theirs. Will they accept ours? I can't say for sure.
Okay, and we'll also share, in addition to the 1050, the 5320 and the M11Q on our website.
Oh, excellent.
Okay, so if anyone has any additional questions for David that were not answered on this program, please send me an email to ssteckler@kblaw.com, and the questions will be sent over to David, and then we'll announce the answers to those questions as a group shortly after the program. So to everyone who attending the program today, thank you so much for joining us on this Senior Law Day collaborative program. We hope the information was useful, and a big thank you to David Sweet from the Westchester County Department of Social Services to share all of his insight on home care with us today. And as our group is truly a collaborative, as other questions come in, we'll do our best to find the answers to them and to pair you with the right person so the information is out there and it's shared with everyone. So, David.
Thank you. Thank you for the invitation, and thank you all out there for your interest in home care services. And don't hesitate to contact us. Every case is a little bit different and requires individual attention.
All right. Thank you, everyone, for joining us.
Take care.